Om Swastiastu, we are from Group SUD B01 of PSSKPD 2020 first semester. In this occasion, we are going to present our student project entitled Special Sense Dysfunctions in COVID-19 Patient. My name is Williem Alexander, and I will start the presentation. Next. And here's the members of our group. Now I would like to explain the background. Phylogenetically, the coronavirus disease, or some may call it SARS-CoV-2, is extremely linked to the previous outbreak in 2002, which was the SARS-like bat virus. Human-to-human transmission is how this virus spreads, according to WHO. There are numerous possible transmission of COVID-19, which includes close contact transmission, airborne, vomit, fecal oral, and also from animal to human. Symptoms of COVID-19. Fever, dry cough, tiredness, and difficulties of breathing are among the most common symptoms of COVID-19. Some studies of COVID-19 reveal that COVID-19 has impacts to special senses, especially gustatory and olfactory dysfunction. Next is problem formulation. The problem formulations are, first, what is COVID-19? Second, what are the general complications of COVID-19? Third, how are the anatomical and physiological structures of the spatial senses? Fourth, what is the impact of COVID-19 towards spatial senses? Fifth, how is prevention of spatial senses dysfunction? And sixth, how is the treatment of spatial senses dysfunction? Next. Next is proposed. The proposed includes, first, to describe what COVID-19 is. Second, to describe what the general complications of COVID-19. Third, to describe the anatomical and physiological structures of the spatial senses. Fourth, to describe the impact of COVID-19 toward the spatial senses. Fifth, to describe the prevention of spatial senses dysfunction. And sixth, to describe the treatment of spatial senses dysfunction. Next is benefit. The benefit includes, first, give general and specific knowledge about COVID-19. Second, disclose the common and specific symptoms of COVID-19. And third, explain the spatial senses dysfunction that is caused by COVID-19.
My name is Mira, Wrycza, and I'm going to explain about the definition and the epidemiology of COVID-19. So, COVID-19 is an infectious disease caused by a newly discovered virus named coronavirus. And this virus was first identified in Wuhan, China. And the specific name of this virus is Severe Acute Respiratory Syndrome Coronavirus 2, and it belongs to the family Coronaviridae. Next. The cases of COVID-19 have been reported in all continents except for Antarctica, and in Indonesia as of August 2020, the occurrence of COVID-19 cases have reached all of the provinces. All ages are susceptible for the transmission of COVID-19, and most of them are aged 30 to 49 years old, and many of the cases are experienced by older people. Next. For children, COVID-19 is less frequent and has milder symptoms, and most patients will heal themselves, while the case fatality rate is approximately 10%. The contributors to the mortality rate are patients above the age of 40 years with comorbidities such as diabetes, heart disease, asthma, etc. That's all from me. Thank you.
My name is Bawa. I would like to explain the etiology of COVID-19, symptoms, and complication of COVID-19. The etiology of COVID-19 is a virus with a spacious name is called Severe Acute Respiratory Syndrome Coronavirus 2. This is the main protein structure of SARS-CoV-2 are nucleocapsid protein, membrane protein, spike glycoprotein, envelope protein, and other accessory protein. Next. This is a key reservoir and mode of transmission of coronavirus. The coronavirus family has a 4 generation of coronavirus, namely alpha, beta, delta, and gamma coronavirus. Alpha and beta coronavirus generally have genomic characteristics that can be found in bats and rodents, while delta and gamma coronavirus are generally found in avian species. Human-to-human transmission can occur via droplets released when an infected individual coughs or sneezes at distance of approximately 2 meters. Symptoms and complications. Symptoms of infection from COVID-19 appear after an incubation period of about 5.2 days. The period from the onset of COVID-19 symptoms to the death range from 6 to 41 days with a mean value of 14 days. The most common symptoms when the onset of COVID-19 is a fever, colds, and fatigue, while other symptoms include sputum production, headaches, hemoptysis, diarrhea, dyspnea, and lymphopenia.
My name is Sendi Aprilio. First step in diagnosing COVID-19 is taking anamnesis, included evaluating patients' epidemiological risk. Then, tracing patients' contact history like travel history, job history, and their onset. Anamnesis also can be done by searching symptoms that usually appear like fever, weakness, and dry cough, or in some patients there is other symptoms like sore throat, myalgia, cough with phlegm, and gastrointestinal problem. Diagnosing COVID-19 also can be done by physical examination like temperature checks, complication checks like pneumonia, sepsis, septic shock, and tachypnea. Body's oxygen saturation is also checked. Examination also can be performed to diagnose COVID-19. Meanwhile, the diagnosis is based and determined by supporting examinations like nucleic acid amplification test that usually used is reverse transcriptase polymerase chain reaction with nasopharyngeal or oropharyngeal specimen. There is also other examination, namely rapid test, but the sensitivity is lower than RT-PCR. There are also viral sequencing tests, and blood gas analysis that can be performed to diagnose COVID-19. In China, imaging also can be done to diagnose COVID-19. Imaging that is usually done is computing tomography chest scan and chest X-ray imaging. Lung ultrasound may also be performed to diagnose COVID-19. Visual system is one of spatial sense that detects light so humans can see. Visual system consists of many structures. First, the eyeballs with the optic organs consists of lens, vitreous humor, aqueous humor, iris, pupil, ciliary body, ligamentum suspensory, and retina. There are also extrinsic eye muscles that lies in orbits. There is also numbers of blood vessels and nerves that supply nutrient for the eyeballs. How the light enters the eye and projected as an image is starting with lights called the visible light enter the eyeball through the cornea.
Okay, my name is Nindya Krisnadewi and I'd like to present about anatomy and physiology of olfactory system. The olfactory system is a kind of spatial sense that detects chemical scents, especially odors. The kind of receptor is chemoreceptor. The nose consists of external nose and the nasal cavity. The nasal cavity is divided into the respiratory area and the olfactory area. Next. The airborne molecules are inhaled through the nose. Then, the odorant molecules bind to the proteins. The odorant protein complex then binds to G-protein coupled receptor on the membrane of olfactory cell. The olfactory receptor neurons unite to form nerve bundles. The axons are called the olfactory nerve. In brief, delivery of impulse can be seen on the slide. Next is anatomy and physiology of gustatory system. The gustatory system is a kind of spatial sense that detects chemical scents, specifically taste. There are 5 primary tastes that can be recognized. They are sweet, salty, bitter, sour, and umami. The kind of receptor is chemoreceptor. In the surface of the tongue, there are papillae that contain the taste buds. The taste buds also can be found in the oral cavity and throat. Next. The first salty is the sense of sodium concentration in the saliva. It will drive their diffusion into the cells and make the cells depolarize, leading them to release neurotransmitter. The sour taste is a response to hydrogen concentration similar way with salty taste. The other 3 tastes, sweet, bitter, and umami, are transduced through G-protein coupled receptor on the cell surface. The sweet taste is stimulated by the presence of glucose, the bitter taste is stimulated by alkaloids, and the umami or savory taste is stimulated by amino acids, especially glutamine. The neurotransmitter will excite the dendrites of sensory neurons. They are facial nerve, glossopharyngeal nerve, and vagus nerve.
Hello, my name is Dewi and I will explain about the anatomy and physiology of auditory and integumentary system. There are 3 regions in the auditory system. The external ear includes auricle and external acoustic meatus. The middle ear includes the tympanic membrane, auditory ossicles, tendons of the stapedius and tensor tympani muscles, chordae tympani nerve, and tympanic plexus of nerves. The inner ear includes the body labyrinth, membranous labyrinth, and internal acoustic meatus. Next. There are several processes of hearing in the auditory system. First, the sound enters the pinna that will cause the pinna to capture and conveys it into vibration. The pinna then transmitted the vibration as a motion to the 3 ossicles, which is then transmitted to the fluids of the cochlea and will stimulate the sensory receptor cells of organ corti. When the hair cells accept the signal, they will respond by activating the neurons of the auditory nerve. Next is the integumentary system. The skin contains the superficial layer or epidermis is a keratinized stratified layer epithelium. The dermis is formed by a dense layer of interlacing elastic and collagen fibers. The subcutaneous tissue includes the deepest parts of the sweat glands, the blood and lymphatic vessels, and cutaneous nerves. Next. There are 4 main functions of the integumentary system. As protection, the skin acts as a barrier against water loss. In the sensory function, there are 3 nerve endings, Meissner corpuscle, Pacinian corpuscle, Raffinius ending, and Krauss corpuscle. As thermoregulation function, the integumentary system with the association of the sympathetic nervous system helps the body regulate its temperature. As the vitamin D synthesis function, the epidermal layer of the skin synthesizes this vitamin when exposed to the UV radiation.
My name is Karina Nityani Kumar, and I'm going to explain about visual and olfactory dysfunction caused by COVID-19. First, visual dysfunction. Although COVID-19 presents primarily as a lower respiratory tract infection transmitted via air droplets, increasing data suggest multi-organ involvement in patients that are infected, including the eyes. But currently, there is no direct evidence to support that viral replication can cause injury and inflammations of the conjunctiva or other eye parts. A team of 11 in Shenzhen Eye Hospital in China recorded the ocular complications of a patient with confirmed COVID-19 after 13 days of illness onset. Their patients developed acute viral conjunctivitis with positive SARS-CoV-2 tests in conjunctival swab samples, indicating that SARS-CoV-2 could indeed cause ocular complications, but not necessarily in the early stage of illness. Next. Second, olfactory dysfunction. The occurrence of smell dysfunction in viral infection is not new. Although SARS-CoV-2 has the ability to enter epithelial cells by directly binding into the angiotensin-converting enzyme 2 or ACE2 protein on the cell surface, olfactory receptor cells do not express ACE2 as well as another gene involved in SARS-CoV-2 entry. Thus, the respiratory epithelium is the primary site of SARS-CoV-2 attachment and infections, as with many other respiratory viruses.
My name is Gede Sutha Samudra. In this opportunity, I would like to present you about gustatory dysfunction. As we can see, gustatory system is all about human tongue. Tongue divided onto 5 parts based on the taste buds, which can detect 5 tastes, including salty, sweet, bitter, sour, and umami.
First is macroclosia. Coronavirus disease 2019 or COVID-19 ruins the human tongue with macroclosia. Acute macroclosia is an unusual disease which can happen to COVID-19 patient. Macroclosia occurs as a side effect of trauma or allergy. The tongue grows bigger every time, from 10 to 12 centimeters long. It causes the patients to have post-operative speech and swallowing difficulties. On the upper left side is the picture of a patient recovering from macroclosia from anterior and lateral view. Second is dysgeusia. COVID-19 also affects gustatory system through the respiratory tract. Anosmia, one of the urine disease, affects patients' perception of flavor and ability to taste food. In other words, they can't taste everything. American Academy of Otolaryngology had an surgery postulated dysgeusia appeared as an effect of rhinitis or chronic rhinosinusitis, may lead to COVID-19 infection, and should be seriously considered to be early presenting symptom. Third is dysphagia. Scientists trying to determine the cause of dysphagia deduce that it is possible from viral effects on the mucosa and upper air digestive structures. Speaking difficulties may be contraindicated in patients with severe cases of COVID-19 that has chain reacted from dysphagia because both of the diseases occur in the pharynx. To sum up, understanding epidemiologic characteristics of COVID-19 will develop our ability to identify gustatory dysfunction.
My name is Putu Dewi, and I would like to explain about auditory dysfunction. A hearing loss case was found in Thailand. An elderly female suffered hearing loss after recovering from COVID-19 infection. A certain type of hearing loss disease, namely sudden sensory neural hearing loss, or SSNHL. Next. SSNHL itself is still undergoing research, but there may be a plausible relationship between COVID-19 and an SNHL. There are several hypotheses that support evidence based on hearing loss caused by COVID-19. First, COVID-19 virus attaches to hemoglobin through B chains and get into the erythrocyte. By chaining to the superficial receptors, or ACE2, the virus infected all tissues. ACE2 can be found in the brain, medulla oblongata, and the temporal lobe. Hence, it affected the hearing center and its straight chance of hearing loss. Second, COVID-19 virus also causes the release of cytokine after the virus is chained into ACE2. Consequently, the hearing center becomes affected to the extent of possibly permanent hearing loss by repairing oxidative damage. And the last one, the decreased perfusion which happen in these auditory organs because of ischemia. ACE2 found in vascular smooth muscle becomes infected and reduces blood supply due to the formation of clots that could cause ischemia damage, which can lead to hearing loss. That's all from me. Thank you. Next.
My name is Darren, and I will explain about the impact of COVID-19 on the integumentary system. Despite the COVID-19 being categorized as a respiratory disease, over the past few months there have been several reports about the effects of COVID-19 on dermatology. The most common symptom is the appearance of rashes across the body. Other common manifestations of skin problems that have been observed in COVID-19 patients include morbilliform rash, COVID toes, levido reticularis, retiform purpura, necrotic vascular lesions, acute urticaria, chickenpox-like blisters, and red half-moon sign in nails. In contrast with a few cases where skin problems are caused by COVID-19 directly, most of the skin problems manifested are actually the continuous use of protective equipment or hygiene products. The continuous use of protective equipment could cause hyperhydration effect, epidermal barrier breakdown, contact reactions, and even blisters, which would lead to the manifestation of a new skin problem or worsen an already existing one. That's all from me. Next.
Hi, my name is Dewa Fony Prema Shanti, and I would like to tell about prevention and treatment about COVID-19. The first is prevention. Many ways could be done as COVID-19 prevention, but the most basic ways are avoiding crowded places, wearing a mask, using hand sanitizer, or washing hands. According to World Health Organization, explains specific rules that must be considered when using masks. The specific rules are: first is not using the public masks in a place with a high risk. Second is for persons who are over 60, having underlying medical condition, feeling unwell, and looking after an ill family member, it recommended for wearing a medical or surgical mask. Third is respirator masks for health workers. Next. According to Kementerian Kesehatan Republik Indonesia 2020, the cases of COVID-19 with mild symptoms can be cured in less than 2 weeks. Research to find effective treatment methods in overcoming the COVID-19 disease is still ongoing. Some of the drugs being studied to treat COVID-19 are remdesivir, lopinavir, ritonavir, and favipiravir. Of this drug, remdesivir was the most effective in treating COVID-19 in some patients. Next. Most of the therapies or treatment for COVID-19 are still in the research and development stage. For example, convalescent plasma therapy and treatment with hydrochloroquine, azithromycin, and combination. Until now, vaccine is still developed.
My name is Winnie Chandra, and I'm going to conclude our presentation. Coronavirus disease is an infectious disease, and it was first identified in Wuhan, Hebei, China. The most common symptoms are fever, cough, fatigue, and other symptoms include sputum production, headache, diarrhea, dyspnea, and lymphopenia. There are visual, olfactory, gustatory, auditory, and integumentary system in special senses. After several months since the initial outbreak of COVID-19, there have been quite a lot of reports which suggest that COVID-19 has an impact on the special senses. In the visual system, SARS-CoV-2 could indeed cause ocular complication, but not necessarily in the early stage of illness. In the respiratory system, olfactory bulb MRI in a patient presenting with isolated anosmia secondary to COVID-19 revealed normal olfactory bulb volume without abnormal signal intensity. In the gustatory system, COVID-19 causes macroglossia, dysphagia, and airway problem. Besides that, eating food and tasting flavor are often blunted because of upper respiratory infections. The relationship between COVID-19 and hearing loss has not been explored deep enough, but the infection of ACE2 receptors could cause reduction of blood supply due to clots that may lead to ischemic damage, which could possibly generate hearing loss. The most manifestations of skin problems that have been observed in COVID-19 patients are morbilliform rash, COVID toes, necrotic vascular lesions, and so on. But the most of the skin problem manifested are actually because of prolonged use of hygiene products instead of direct cause from the virus. Next. There are several ways that should be done for COVID-19 prevention, such as avoiding crowded places, wearing a mask, washing hands often with soap, and doing basic hygiene. Here are the references that we use for our student project. This is the end of our presentation. Thank you for your time and attention. We apologize if we made mistake intentionally and unintentionally. We will close this presentation with Parama Santi. Om Santi 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 Om. Thank you.